Hey, this is Dr. Gay from First Sec MRI, and this is a 15-year-old male who twisted the knee recently, had a popping sensation and lots of pain and swelling afterwards. And on this view here, we have an axial view of the knee where we see the kneecap in the front, we see the femur and back. This is the back of the knee here. And on this side view, the same thing, we see some arrows pointing to a problem in the kneecap. This is the kneecap here again, quadriceps tendon coming down at the top, patellar tendon here. This is the femur, the big thigh bone. This is the tibia. And we see lots of white stuff here. This white stuff is fluid at large, or we call it a massive joint effusion. And the arrows are pointing to a defect, a large defect involving the articular surface of the kneecap. The cartilage and the underlying bone are absent. So here it is right here, a big hole in the patella. So when we see this, we think of a dislocation. When the patella dislocates, it goes laterally, and sometimes it can knock off a piece of bone. Sometimes it'll just get a mild bruise of the cartilage or contusion of the cartilage. Sometimes you have a very minimal bony injury too, a mild bone contusion or a small chip fracture. But this is very rare to have such a large defect. They caught it just right to knock off that piece of bone, and it involves almost the whole articular surface. So now we have to find out, well, where did it go? So if we come down, we see this very large white collection of fluid. This is a massive joint effusion. As we come down here, we see a couple little pieces over here. This is not normal. These are little fragments of cartilage, maybe bone, that are floating out here in the lateral side. If we come down here lower and lower, you can see where we're getting over here, almost down to the level of the joint now. We start to see this, and this is about the right size. It's a big fragment. You can see that it has articular cartilage here along the edge of it. So this looks like it is the fracture fragment from the kneecap. And you can see the femur. This is the outside. This should be round and nice. Instead, we see this scalloped. So this is an impacted fracture of the femur. Instead of being rounded, it's crushed inwards, and this fracture fragment from the kneecap is sitting over it. We can look at these same things on, let's see, this view here. We see the bony defect. We see the fluid, which is white. We see the brightness here in the bone. This is a bone contusion. And over here, we see that big fracture fragment from the kneecap that's sitting over here over the lateral knee joint. This is another view looking straight ahead. You can see the large patellar fracture fragment here, and over here we see it again with the outline. See a little bit of fluid between the impacted crushed fracture here, the femur, and that fracture fragment. And that's it. So this is what we call a transient patellar dislocation with a fracture fragment from the kneecap that's displaced, and then associated impacted fracture of the femoral condyle here. And that's it. Thank you so much.